Okay. Okay, let's go ahead and get started. Good afternoon, E3 scholars, ACMG experts, as well as fellows, mentors, and others currently on track to a career in the field of genetics. Welcome to the second session of the E3 Equip webinar series. Today, we are privileged to be joined by our speaker for this session, Dr. Katie Mascia. Dr. Katie Mascia is the Director of Clinical Services at the Central Pennsylvania Clinic, located in Belleville, Pennsylvania. The Central PA Clinic is a medical home for local Amish and Mennonite children and adults who have rare genetic conditions and complex healthcare needs. Dr. Mascia is board certified in medical genetics and pediatrics. She completed her combined pediatrics/medical genetics residency at the University of Alabama at Birmingham in 2021 and was chief resident in medical genetics during her final year of training. Between her first and second years of medical school in 2014, she was an ACMG Summer Genetics Scholar. Dr. Mascia has a passion for education, and in addition to mentoring medical students and residents, she has a faculty appointment through the Geisinger Department of Maternal Fetal Medicine and is involved on the Pennsylvania State University Department of Nutritional Sciences Advisory Committee. Dr. Mascia is honored to be able to work with the Plain community and loves learning from her patients every day. Please welcome Dr. Katie Mascia.
Hi guys, my name is Katie Mascia. I'm a medical geneticist, and I just wanted to thank everyone for giving me the opportunity to give this talk today. So I will be talking about, how do you become a medical geneticist? What are sort of the core parts of the job, as well as what my typical day looks like, which I admit is a little bit outside of the norm for most geneticists. And hopefully this picture on the intro slide gives you a little bit of a hint as to what I do every day. So it's a very common question that, most adults get asked, small talk, what do you do for a living? And when I tell folks who are not in the medical field that I'm a medical geneticist, people really have no idea what I do. So it's okay if you have no idea what a medical geneticist does either. So most people will follow up with, well, do you do research, or what exactly is it that you do? And the answer is yes and no. So yes, you can certainly become involved in research as a medical geneticist, either clinical or bench research. But in this talk, what I'm going to focus most on is the clinical aspects of the job, because at its core, medical geneticists, we're physicians, we're doctors, we see patients, and we help to diagnose patients with rare diseases, as well as develop treatment and management strategies for those rare diseases. And the best part, well, maybe I should say, one of the best parts about being a medical geneticist is that you get to help a lot of different people. So there are a lot of different types of patients that you can serve as a medical geneticist. You are not limited to any one of these fields, pediatric, adult medicine, etc. You can do any combination of seeing whatever patients that you feel most passionate about in this career, which is a really fun thing about being a geneticist. Now, traditionally, most genetic disorders were initially recognized in infants and children. So many medical geneticists do have expertise in taking care of children, which would be pediatrics. However, we are discovering more and more genetic conditions where the start of symptoms actually occurs in adulthood. And so many times a geneticist will also be taking care of adult patients as well. And sometimes our medical care has gotten so good over the past few decades that our children who were diagnosed with these conditions are living and becoming adults. And so it is important for them to be followed by an adult provider, but also to have that geneticist help to inform their care as it pertains to their specific genetic diagnosis. Additionally, you can take care of patients who are pregnant. Some of the adult patients that I referenced before will become pregnant, and sometimes based on their diagnosis, there might be specific concerns or things we need to watch out for during a pregnancy. Alternatively, a geneticist might be consulted if perhaps there are differences that are identified on routine prenatal screening. So, such as when a pregnant patient comes in to get an ultrasound and there might be a birth defect identified. Sometimes the geneticist is consulted at that time to recommend, possible genetic testing or other strategies that might be needed for that particular patient. Additionally, if you are interested in cancer genetics, that is another option for you to become involved in, and particularly in cancer syndrome. So cancers that run in families. So if you see a patient where everyone is dying of breast cancer in the family, that can also be something where a medical geneticist might be able to help guide their care. And then last but certainly not least, you can be involved with the care of patients with inborn errors of metabolism or metabolic genetics. And so these would be patients, for example, like phenylketonuria or PKU would be the most common inborn error of metabolism. And these geneticists would work closely with sometimes a metabolic dietitian for dietary management of their disease, but also more and more there are medical treatments for these conditions, including enzyme infusions, medications, as well as liver transplantation. And so the geneticist is also heavily involved with these patients throughout the course of their lives as well. So there's lots of directions and opportunities in this field, which is what makes it so exciting. Now, when you are trying to diagnose and manage a patient with a genetic condition, first and foremost, you have to identify what is actually going on with this patient. So how do we get to this diagnosis? So I've listed here the major tools in a medical geneticist toolbox that helps us to diagnose these conditions. So first and foremost is listening to the patient, getting a good patient history. What symptoms are they having? And sometimes we go all the way back to the beginning, like, were there any differences during the pregnancy with this child, for example? And so listening to your patient, seeing what other subspecialists the patient has seen can give you a really good clue as to what could be going on here. Now, traditionally, geneticists, way back when, did not have the accessibility to genetic testing. And so geneticists really relied on the physical exam, which we still do, but now we are kind of incorporating genetic testing and genomics into the diagnosis of patients. So in terms of the physical exam, for geneticists, this is called a dysmorphology exam, which if you look it up in the dictionary, it'll tell you it's a study of abnormal form, but what does that really mean? And what it means is that geneticists, we're looking for clues. We're looking for differences in your patient, whether it's a child, adult, fetus, whatever, that could point you in the direction of what could be going on, what could be the root cause of their symptoms. Now, these differences or anomalies could be obvious, like a big old hole in your heart, or intellectual disability or hearing loss, or these differences could be really subtle, something that, other doctors or even the parents of this child might not have ever noticed before. So this would include, creasing patterns on the palms, certain birthmarks, the shape and placement of the ears, of the eyes, etc. And so, looking at these subtle clues is sometimes what is going to give you that aha moment. Like, this is what is going on with this patient, just based on this very seemingly insignificant finding on your exam. And this is why geneticists, we like to think of ourselves as the Sherlock Holmes of doctors. We're kind of, pondering about these really minor clues to try to get us to find the answer for what is going on with the patient. We also place a lot of importance on the family history. And when we take a family history, I tell patients, I go really into the weeds with this. And, what you're looking for is patterns of inheritance. Are there any other family members with similar problems to your patient, or even problems that might, at first glance, seem to be unrelated, but are actually due to the same genetic variant in some cases? And knowing, what is important, what is not in a family history, that comes with a lot of time and experience with seeing these patients over the course of your training. And then last but not least is genetic testing for these patients. And so with the advent and widespread availability of genetic testing in more recent years, choosing, the right genetic test to really, incorporating personalized medicine is so important in this field, because we also have to make sure that, depending on the patient's insurance, for instance, that we're choosing the right genetic testing company. And sometimes, unfortunately, for better or worse, the insurance company dictates what genetic testing you might have to start off with. And so kind of navigating that sphere is also a very important aspect of this job. And then additionally, once your results come back, as a medical geneticist, you have to kind of look at these results and say to yourself, well, does this result explain my patient's symptoms, or do they not? Do we have to do further evaluations? And so that is another important part of integrating the genomics with your experience with the patient and getting to know the patient. And then finally, last but certainly not least, throughout this entire process, you are constantly educating the patients. You have to meet your patients where they're at, because genetics is really complicated. And explaining the results, counseling the patients before we get the test results is extremely important, and it's an important aspect of the job. So if you really like educating people and teaching, this might be the field for you. Now, how do you become a medical geneticist? So, long story short, I know there's a lot of writing on this slide. It's a long road, and it's a challenging road, but it's worth it because our patients are worth it. And at the end of your journey, you are going to be an expert. You are going to be looked towards by other medical professionals, but also your families and your patients for advice on their condition. And not every doctor has this type of experience. And so you are going to be able to offer something that is very unique to the overall care of your patient. And so, looking at, all these years of training, it can be a little bit daunting, but I promise you it is worth it in the end. So my journey personally, what I did is, so I went to college. I majored in molecular biology, so it's 4 years. I went to medical school for 4 years, and when I went into medical school, I kind of knew already that I wanted to go into the field of genetics. So I wound up doing a combined pediatrics and genetics residency, which was 4 years. So that's 12 years of school, which is, as you can see on here, the minimum amount of training that you need to do this job. Now, there are other ways that you can become a geneticist. If you like taking care of adults more, you can do an internal medicine residency. Alternatively, if you really like the prenatal or taking care of pregnant patients aspect of it, then you can do OBGYN residency and then go on to do maternal fetal medicine and genetics. And then if you're really interested, you can do a metabolic genetics fellowship, which allows you to gain expertise in taking care of those patients with those inborn errors of metabolism that we referred to before. Now, where do most medical geneticists work? This is actually a picture of one of the hospitals where I did my training. So most medical geneticists will work in a more urban setting at a large academic medical center. And you're going to have lots of subspecialists, lots of resources at your fingertips. So if you need to refer your patient to cardiology or neurology, wherever they need to go, they're going to be right there, and they're going to be there to give you advice very easily. You're also going to have a large team of folks who are going to be really integral to the care of your patient. And, and this includes folks across multiple disciplines. And if you're lucky enough, you might be able to work at a place that has a genetic testing laboratory or even a metabolic or biochemical lab for testing for your patients on site. So that is also a good opportunity. Now, in contrast, and I warned the E3 committee that I do not do what most geneticists do. So, but they still allowed me to give this talk. So, so hopefully y'all will enjoy that my experience is a little different. So I specialize in taking care of patients with rare disorders in the Plain community. And so that means the Amish and Mennonite populations in our specific area of central Pennsylvania. Now, this is a picture of our clinic. As you can see, it's very rural. We're surrounded by cornfields. Our clinic is a nonprofit organization and it has a private practice set up, so it's not really an academic institution. We do have some metabolic testing in-house, which is extremely helpful to us. But really, first and foremost, we are providing specialized genetic services to a very medically underserved population. And this is truly mission work. And so if you are interested in genetics, but also kind of interested in like mission work or Doctors Without Borders, this might be the niche in genetics for you. So at its core, I practice population genetics. And in any genetically isolated population, there are certain conditions that are much more common in that population compared to the general population. And why is that? Well, going back to high school biology, it's because of non-random mating. This can arise for a lot of different reasons in people. So you can have, geographic reasons for non-random mating. Maybe this is a small isolated village in Alaska or on a remote island in the South Pacific. You could have, cultural reasons, people marrying only within their group, religious, historical reasons. Any of these situations can come into play that can lead to a population becoming genetically isolated. And what that means is that this specific population derives from a small number of ancestors or founders that in more recent times are really only marrying or having children amongst themselves. And if you learn nothing else about the founder effect, this is what the founder effect is, you increase the frequency of recessive conditions. And that's because you're increasing the frequency at which carriers for the same condition, and oftentimes in these populations, the same exact genetic variant are having kids together. And so I see a lot more recessive conditions than the average geneticist, but that's not to say that I don't see plenty of dominant conditions and conditions that are ultra rare, brand new in the patient. We see everything at our clinic. So I was also asked to, talk a little bit about my personal journey. Why are you doing this? So, so I do have a genetic disease in my family. My grandmother had SMA, or spinal muscular atrophy. It is a neuromuscular condition, and thankfully for her, she had a less severe form of the condition because I was able to know her. Now, folks with the more severe form of the condition without treatment usually pass away before their first birthday due to weakness in the breathing muscles. Now, my grandmother was much more than her genetic disease. She became a teacher, and she was actually the primary breadwinner for my mom's family. And her story really inspired me to take care of patients with rare diseases. And now actually it's super exciting, but in today's day and age, just a couple of years ago, really, there was actually, there are now multiple treatments available for this specific condition, and there's even a gene therapy for this condition as well. And so that also goes to show you that this field changes every day, and advancements in medical genetics are being made every single day. And so if you like routine, if you like things to go as expected, this might not be the field for you because things are changing every day and you're constantly learning something new, which I think is really fun. Now, throughout high school as well as college, I fell in love with the basic science of genetics. I majored in molecular biology, and I knew in college that I wanted to do something with genetics. So I was probably in a very similar position as all of you, saying, well, I want to do something with genetics, but I don't really know what. But ultimately, I decided I want to take care of patients. And so that meant that I was on my way to med school. And so in medical school, there is a saying. It is when you hear hoofbeats, think horses. Don't think about zebras. Horses are referred to as very common diseases like high blood pressure, diabetes, etc. Zebras are the rare diseases. And I was thinking to myself during med school, well, who's thinking about the zebras? If everyone's thinking about the horses, who's going to be there for these patients with the rare diseases? And so that's what I wanted to do. Also, I thought that the rare disease pathology is much more interesting than seeing diabetes all day long. It's kind of the spice of life. And so that also attracted me to this field. Now, in genetics residency, I realized that I kind of liked everything. I really liked prenatal genetics. I really liked metabolic genetics. I liked cardiac genetics, dysmorphology. I kind of liked everything. And so I wanted to go into an aspect of this field where I could do a little bit of everything and be more of a generalist. I was also very interested in serving a specific population or cultural group. I did some clinical research with the culturally deaf community in residency, and so that was also very interesting to me. So I wound up reading this gentleman's paper. So this is Dr. Holmes Morton, and he is a pioneer in the field of Amish and Mennonite genetics. And I'm not exaggerating, but he developed the special formulas for maple syrup urine disease and glutaric aciduria type 1. And it's because of his work that these children who, before his treatment plans would be neurologically devastated, now can live a completely normal life. And I'm very privileged to be able to work with him and to learn everything I can from him. This is a picture of our staff. We have a very small but very dedicated staff at our little nonprofit clinic. So yes, that's kind of what brought me to where I am today. Also, people ask me, why are you working in the middle of a cornfield? And this is another reason. It is very aesthetically pleasing, to say the least. What is burnout? Because you just take a walk outside and the views are very beautiful. Now, I'm sure in all of these webinars, people are going to tell you, what does an average day look like? And there is no average day. Every day is different, and we're constantly learning from our patients. Our patients are our best teachers. So on an average day, I am doing a lot of clinical work. So I am, seeing patients. And as you can see, when was the last time that you were in the room with the doctor for 2 hours? Like never. In this population, it is very important to build rapport with these patients. Get to know the patients, get to know the families. It is very important culturally for this community. And so that is true in general for medical geneticists. We do spend more time with our patients than the average doctor, and that's because there is so much education and counseling that is required. I mean, genetics is complicated stuff. I'm also doing a lot of home visits, and if you want to see where your patients are truly coming from and meet them where they're at, go and visit their home. And it is a very eye-opening experience. And in this population, sometimes you walk away with like a loaf of bread or some cookies that mom just baked. And so that's also fun too. I'm also doing a lot of genetic counseling. I would love to have a genetic counselor work with me, but we currently do not have one. So I'm doing a lot of the genetic counseling, returning results of genetic testing that I order, as well as, we're big proponents of carrier testing because of all those founder variants that we deal with every day. And so I'm also returning a lot of carrier testing results as well. A lot of people will also ask me, what are the most common disorders that we see in terms of the founder variants? And so here's a little list. Of course, we see more disorders than this, much more, but these are just the most common. And so, as you can see from this list, it really is variety. And that is the most fun part about this job, is that you get to do, so many different things, and learn about different parts of the body, and it's just very intellectually stimulating. So as you can see here, we have a blood disease, we have a neurologic disorder with seizures and autism, we have a kidney disease, and then we also have inborn errors of metabolism. And that's just to name a few of these conditions. We really see much more than this. Something that is not necessarily unique to me, but is true of any medical geneticist, is that it's inherently multidisciplinary. Genetics is relevant in so many different fields, and you get to work with so many cool people. These are some of the collaborations that I have, and as you can see, I work with cardiologists, hemonc physicians, family medicine, primary care, OBGYN, plastic surgery, ortho, you name it. I also do a lot of outreach, so I'm working with the CDC actually on vaccine outreach to isolated populations, as well as outreach to the lay midwives in our area as well. Now, when you work at a nonprofit organization, you do a lot of fundraising. And so on an average day, I might be heading out to go to an auction, or, work at a 5K or something to help raise funding for our nonprofit. I also thought that this picture was pretty interesting. It's actually from our most recent auction. And so in our little valley in Pennsylvania, we actually have 3 buggy colors that we see. And the yellow tops, this is the only place in the country that you're going to see those types of buggies. But we have the yellow tops, we have the black tops, and then right here you can see a little white top buggy. I think most of them were parked, up here, but I thought that was a neat picture to share with you guys. If you are super interested in learning more about what I do in terms of, Amish Mennonite genetics, I really encourage you to read this book right here called A Fragile Heritage. It's written by a mom of a child with maple syrup urine disease. And it's all about their journey, from diagnosis to eventually their decision to get a liver transplant for their child. And you would think, a book written by a Mennonite mom would not be well written, but it actually is. And so I really strongly encourage you to read this if this field is in any way interesting to you. This book is a really good reference for Amish culture, if you're interested in learning more about that. But alternatively, if you're more of like a Bridgerton fan, there are Amish romance novels available. This one happens to take place in Big Valley, where we are located. And then similarly, in the same vein, this is an Amish murder mystery that's also set in Big Valley as well. So there's something for everyone, right? Now, I will leave you guys with this picture of my daughter at our most recent auction. She's having fun with a wheel plow. We did not go home with this wheel plow, by the way. We did not win it at the auction, although she did have fun with it. And I'll be more than happy to answer any questions that you guys might have. And I wanted to thank everyone for being here today and for giving me the opportunity to give this talk. Thank you.
Thank you so much.
Okay, I'm gonna go ahead and stop sharing my screen. So if we could all pop on the screen and look at each other's beautiful faces, starting with me. I see that I have not started my video. There we go. Yeah, so thank you so much, Dr. Mascia. That was such a wonderful presentation. It really tells you how, the spectrum of the different ways that you can serve as a medical geneticist. So we do have a question on the chat. So I'll start with that one, and then anyone else, I see a couple of hands up, can go ahead and ask theirs. So Eric, if you could unmute yourself and ask the question, that would be amazing.
Yeah, sure. I just wanted to ask, when you had like the sign up for the overview, like how to get to like where you are right now, for the residency selection, why do you pick peds and genetics over IM and genetics, or like OB-GYN and genetics?
Yeah, that's a great question. So it really depends on what you are most interested in, really and truly. So personally, I picked pediatrics over those two other specialties because um, number one, I really liked how kids are a moving target. I really love developmental milestones and, following their growth curve. And also, babies are very cute. And I liked babies as well over adults or, pregnant patients. But it's really up to you. At the end of the day, in genetics residency, you will get experience in taking care of the prenatal aspect, the cancer genetics aspect, adult and pediatrics as well. So you'll get exposure to all of those in the genetics part of the residency, but it's really about your core learning in terms of what types of patients you want to gain expertise in, talking to adults or talking to kids and dealing with parents, or really becoming a physician and a surgeon if you want to go the OB-GYN route. So it's really up to you.
Thank you.
Okay, so I see Adele. Did I pronounce your name properly? Yes, go ahead.
Yeah, hi. I was just wondering, in terms of, is it also being a medical geneticist, if you say are interested in psychiatric disorders and developmental disorders that are more of a mental health vicinity, or is it something else?
Yeah, so definitely medical genetics is relevant to so many different fields. And one of those is absolutely, the psychiatric, mental health, developmental field. I kind of, a very common consult for a geneticist and a very appropriate consult would be, a child is coming to you with developmental differences or autistic behavior.
Mm.
And, our genetic testing isn't perfect for neurodevelopmental disorders at this time, but it is improving with all the research that's going forward. And I will say that with psychiatric conditions,
Well, schizophrenia.
sometimes right, it's sometimes if it's a primary psychiatric condition, the genetic testing is really spotty, it's not the best, but I have hope that in the future it will get better because clearly there is a family history component. Folks with like bipolar disease, for instance,
Mm.
are much more likely to have a family member who also has bipolar. And actually, there is a gene in the Amish of Lancaster County that does predispose folks to developing bipolar disease. And so we know that there's a link there, but it's not the best right now. But
Mhm.
definitely, the way I think about it is that you can certainly do a genetics residency and then go on to do like developmental peds or cardiology or, anything like that. And it'll only make your application stronger.
So it appears that maybe given the limitation that it's still kind of people are still researching it, so maybe more relevant. If I'm specifically interested in like the whys and hows, then it would be more research than clinical type application, right?
At this time, yes, but again,
Mm.
that's with, genetics in 2025. It might be completely different
True.
even in a couple years from now. So yeah.
Awesome. Appreciate it.
Mhm.
Dr. Sanchez, you had your hand up.
I just wanted to say hi and support exactly what you're saying. It's interesting in our specialty just to say, why do you pick internal medicine versus peds? What's nice about it is it's a professional specialty and no one chooses for you. You choose the direction you want to go. You might be swayed one way or another versus, lifestyle. You might be swayed by your personal history, but no one's going to tell you you have to do that. The job market might be limited for genetic psychiatric diseases, but if that's your passion, what's nice about our community is we're very supportive, and you will be assigned a mentor, you will get some guidance on careers and what's a viable path. It really depends on how much you want it, because we have I know a psychiatrist that spent a year with us and he practiced psychiatry, but yet did a full genetic residency. And Kitty's mentioning, you could be a cardiologist like Hal Dietz and do genetic fellowships, and it's really about your passion and your comfort and where you want to be in a career. So I just wanted to chime in a little bit.
Thank you.
For saying it.
So I had a quick question. So you mentioned your interest in college, going back to high school. Are there certain classes or subjects that that you would recommend, to focus on? And then what type of, what the specific classes did you focus on in college or even before college, right?
Yeah, I was always a biology kid. I always loved biology. So, I definitely think that AP biology helped me a lot in college, and when I was in high school. And then in terms of college classes, definitely biochemistry was extremely helpful, although very challenging class. And then, any molecular genetics class is only going to help you in genetics residency. Something that I really wish I had taken but didn't have time in my schedule to take was anatomy in college, because in med school that was a big part of medical training, and I wish I'd had a little bit of exposure in college. But so that would be another class that I would recommend, even though we geneticists, we like to think about things in terms of pathways and esoteric, cellular level or molecular level pathways. But I think anatomy would have also helped me a lot looking back.
Yeah, it's interesting you say that, because in college, usually the A&P or anatomy and physiology, that's a course that is more geared towards, nursing or other type of clinical, instead of like a pre-med type of pathway, if you will. In line with that, I had a follow-up question. In terms of, your summers or beyond during the school, did you do any research or internships or shadow that helped you figure out your path? I know that you mentioned you're a mentor that you get to work with now, and you mentioned the reason why you're a part of this community and why you became a medical geneticist, specifically in your field, in the particular field that you're in. But was there anything beyond that, that kind of supported this path?
Yeah, that's a really good question. So, in terms of picking medical genetics over research. So I did do a lot of research in college. And so, spent not all of my summers, like I studied abroad one summer, but I did spend at least 1 or 2 summers doing research in a bench research lab. And it was actually a neurobiology lab. It was very interesting work. But that experience actually showed me that I really wanted to work with patients as opposed to, just doing research. I was more of a people person for sure. And then I did some shadowing with a medical geneticist. And I kind of knew, like, this is my place, these are my people. And so that's what I would really encourage you, is to explore different aspects of the field. Don't be afraid to get out and shadow. I probably shadowed a little bit too much because I was so passionate about medical genetics, but that's why I'm trying to give back and give back to students now.
Thank you. And I'm sorry, I have one more follow-up. So guys, you got to come up with your questions because I will keep asking, and I want you to ask your questions too. So most of our students that are all our students that are a part of this program are either already in college, right? So their first or second year of either, of college in general, or they are in high school. We have a few high school students. So in terms of where they are now, what would be your advice for them if they would like to go into this field?
So the first step of going into this field is getting into med school. and that is a bear. It's very competitive, and um, you sometimes have to make sacrifices where maybe your friends might be going out and having fun, and you're studying for the MCAT, or you're studying for your full course load. But so yeah, so sometimes uh, there are sacrifices that need to be made in college, but it is worth it in the end. And so that would be my biggest advice, is having a strong application to go into medical school. If you want to be a medical geneticist, that's kind of the first step. Certainly research experience will help you with that application to med school, but also you can incorporate your passion for genetics with your research as well. And so you can do, bench research, or clinical research even in the genetics field if you just can't get enough.
Eric, I see your hand up. You can go ahead and ask your question.
I don't know if you're gonna remember this because I mean I'm sure this was like a while ago, but for your med school app, like what was like some of your most impactful activities you did?
Oh yeah, I'm so old, so it happened a long time ago. I think I'm trying to think in terms of my med school interviews. A lot of people did ask me about my research experience. So I think that was a strong component. I think I started doing research maybe my sophomore year of college. And so they asked me a lot of questions about that. Um, and then also I did a lot of shadowing as well, and so they wanted to hear about my experience with that. I think I was also involved in a couple of different teaching positions and leadership positions, and so I think those were helpful for me. So I think, what did I do? I was basically it was a teacher for the genetics course at my college, and so I developed a passion for teaching doing that. And then I was also an orientation leader, and so that kind of was very different for me. I'm more of an introvert myself, and so that was really pushing me out of my comfort zone. And so just doing things, having experiences that you enjoy, but will also make you stand out in your applications. It can be difficult, but just to follow your passion would be the most important thing, because you're going to have to talk about it during your interviews, and you have to at least fake that you liked it. Or maybe if you didn't like it, you could explain why, and maybe why that drove you into one field over another.
If you don't mind, what was your undergrad research in and like how did you get those opportunities?
Yeah, that's a good question. So my undergraduate research was in epigenetic modifications in epilepsy, in particular in the hippocampus. So it was animal research. So we worked with rats, and basically just, I think I focused more on DNA methylation, and then there were a couple of other undergrads who focused on different epigenetic modifications, such as like histone acetylation, etc. So my focus was more on DNA methylation patterns in the epileptic brain. And let's see, and how did I get involved with that? So basically, I just emailed people out of the blue. And I know that sounds very intimidating to do, but if there is a researcher on your college campus who maybe has taken other students in the past before, or is working on a project that you are interested in learning more about, that would probably be the best way to start, although for introverts it can be scary.
Can I butt in a little bit? I love the question and I love the answer, and I just wanted to support the answer in a different way because I interview a lot for medical schools, and I know I get a sense of who's ready and who's not, and it, like Katie was saying, it's leadership is a big quality, and then taking initiative. To be a physician, you're in a position of leadership, and if you're not ready for it, you could read into it, and so it really, there's no one signature that you could see that this person did everything, checked all the boxes. Okay, they're ready for medical school. It's maturity. And you could be I had a student that would just go to a senior citizens facility and teach cooking. But she took the initiative to get the job. She carried the pots and pans. She loves to cook. And I'm like, she's memorable. And so leadership, being memorable, being mature, finding your passion are all things that are really nice things to say. And there is no one, research project that will get you to the yes answer, but, being confident about it, whatever you do is a signature that we really need, because you're like, well, I helped, on this project, and, like it, you really have to work on a little bit of your interview skills as well.
Thank you.
You can go ahead and ask your question, Adele.
I'm just curious. I think we've briefly talked about it before. I mean, one of the speakers talked about it before already. But I was just wondering if we could refresh. What would you suggest in terms of searching for undergrad research opportunities, say like for someone who's in a community college, for example? What would be what are the options, I guess, and how to look for it?
Ooh, that's a good question. So if you were at a community college and maybe there wasn't a researcher who was working on a project that you'd be particularly interested in, I would try looking at your nearest either like an academic medical institution or even, a local university to see. They don't even have to have a genetics department, but if you were really interested in genetics or, psychiatry, for instance, is there a research project going on with mental health? Or if you're more interested in talking with patients with rare disease, is there a particular person in your area who's interested in a certain disorder, even if it might not be something that you've ever heard of before, but if it's something even tangentially related, just to get that experience is really important. And again, I would just email them out of the blue and say, hey, this is my name. I'm a student. I'm very interested. Could we set up a time to talk about your research? I'd be really interested in participating in your lab or helping in your lab or something like that. And so sometimes it does take that initiative. It can be scary, but that would be from my perspective. But I don't know. I really appreciate Dr. Sanchez's input as well.
I love everything you said, and I get plenty of cold emails from people who are completely unrelated to our institution. And what I would just encourage you to do is pick a topic that you want to do. And if you do a 2-week project, that we could read through those applications that they just squeezed it in before their submission. Find something that you build a relationship, you get a mentor. And so if you connect with someone, they'll write a stronger letter. And if it's a topic you're interested in, you might actually use that during medical school or in your summers. There's plenty of summer programs. ACMG has a summer program that provides mentorship. You're going to be assigned a mentor for this program. We always call our friends. And if you say, I really want to do psych genetics, and there's virtual, experiences, but I like what Katie said is, if you have a passion already, there are family support groups that have projects that you could just, go to San Diego for the summer. Or I had a student in all their senior high school year, they came from San Diego every Friday on the train to Los Angeles. She got into an MD PhD program. She was very proactive about her learning. And just taking the initiative shows that you're a person who gets what they want. And so, but I also don't want people to waste their time. Like just to check off a box to say research is, I did summer research in cancer, on cancer survivors in pediatrics. I felt like I could add that to my resume because I wanted to do a little bit more of that social aspect of research. But, there are plenty of doors open. You just have to start knocking on them.
Yeah,
Thank you.
and I will add, I will piggyback on what Dr. Sanchez said. This program is built for that, is structured in a way that, you can connect with a mentor. So hopefully you've had I don't know if you're a part of that component, if you shared that you wanted to have a mentor but definitely we can connect after this meeting, and I can make sure that we find you a mentor if you don't have one yet, to be able to explore those options. And just that's a big deal, just knocking and just cold calling. I would agree with that 100%.
Yeah, no,
One more thing to add on to it, though. This generation is very proactive about asking for what they want, but wanting to get paid for what they do. And um, I didn't get paid for my first job until I got finished with residency. And so, if everything I did, I volunteered at AIDS research, I did lots of cool things, but they paid me in teaching. And so, you know,
I'm an older
obviously I'm paying
millennial.
bills,
I'm with
but
you.
I haven't had many students, they really decline doing projects for free, and that's a great generational thing. But if I pay you, I'm going to make you work. If I don't pay you, I have to teach you. And there's a little bit of a relationship that's different. But there are plenty of paid internships out there, but it may not be exactly what you want to do because
Yeah, I'd rather do what I want. I'm an older millennial. I'm on that mentality that if somebody's giving something back that is valuable that I needed, that which is teaching in this case, then yeah, it's nice to be paid, but goals, priorities.
Yeah, and
Thank
sometimes it's just it's hard to believe, but even just like a Google search, like if there's a particular area of interest, just to look it up and see if there's anybody in your area doing research, or at your local college, university.
Thank you.
Some great questions. Thank you for sharing. I'm sure that there are maybe a few more questions. We have time for maybe a couple more questions. I had a question, just switching over a little bit from the academic experience for Katie, for Dr. Mascia. So what challenges do you face in terms of access to care? In terms of, we're talking about the Mennonites and Amish community and the religious beliefs, right? So what are some components of that you need to know, or that you shared a couple of books about that, but just wanted to hear from you. What are some components to the job that you have to be aware of culturally and religiously wise?
Yeah, cultural humility is a huge part of the job. And so being aware of where your patients are coming from is extremely important. And I can talk for like hours on this, but I won't. But basically, long story short, is that the Amish Mennonites are really an underserved population, just like any other, but it might just have a little, Pennsylvania Dutch flair to it. So there's a language barrier, but it's not, typically, in residency, language barrier is either like Spanish or maybe the family's deaf, they use ASL, but they speak Pennsylvania Dutch primarily in the home. And so, and for their church services, they speak German. And so it's a little bit of a German flair to it, but, they have transportation barriers. And it's because they use a horse and buggy for their transportation. And if they have to travel farther than 10 miles or so, they usually have to hire a driver. And sometimes these drivers are very expensive, and they've already spent hundreds of dollars before even walking through the door to your clinic. And so there are lots of the cost of medical care. They don't participate in insurance. And so they are truly self-pay and practicing very efficient medicine, making sure that you're only ordering labs that are going to help you really make a decision about this patient, is kind of a fun challenge that I think. But yeah, it's very rewarding working with an underserved population, but there are challenges that you can either look as a deterrent, or you can kind of see it as a fun opportunity for you. But yes, being culturally aware is extremely important when working with this population.
Thank
I
you.
think Eric has his hand up.
Have you faced like any ethical or moral dilemmas as a medical geneticist?
Oh, all the time. Yeah, so ethics, always come into play. And there are some geneticists who kind of go that route, becoming involved on the ethics board at their hospital. And they're even since starting my job here, ethical considerations in terms of, cultural differences between the Amish and the hospital. Sometimes the hospital physicians don't understand where these families are coming from, and so they call like children youth services, and and it creates a whole mess. And so sometimes I'm actually called as more of a cultural consult, as more than a genetics consult. But geneticists in general, you get into issues of morality and ethics all the time. And so if you're really interested in that, you'll see that a lot with your patients.
Can I chime in on that one? I love the topic and the question. And when we were planning these sessions, we were going to have a twist about these cases that everybody's going to struggle with. And the nice part of being a doctor and in healthcare is you're not on an island. You really have to phone a friend, learn the culture, learn societies that you've never been part of, and you don't rush anything. And so, Katie mentioned difference between morals and ethics. And I think if you look up those definitions, it really is an important foundation that you have to build, because, there's only one moral code, but there's very different ethics rules depending on the year that we're in and what is legal and what's not. And so it is a moving target. And, you might do more harm by doing more because the family has to pay their bills in cash, and so they'll lose their farm by just using that one formula that you think is the best, but in fact, breastfeeding might be fine. Or there's so many different conversations about genetics, and what you feel comfortable with may not align with what the family has to make decisions on. And I think you get a lot of training on doing non-directive counseling, because it's not really what you want to do, it's what is important for the patient, and you have to take yourself out of that signature. So it's a really great question though, and I think we should probably do a side session specifically for being the human side of medicine.
Yeah.
I do see Dr. Morton on the call, and I just want to honor the fact that you're here, and just, if you have anything to chime in to support Katie's lecture and the conversation.
Unmuted. Well, I don't want to take anything away from Katie, because I thought her talk was just excellent, and I did know Holmes Morton, and not a relationship to me actually, but it was really great, and so I enjoyed every minute of it, and thank you for taking your time to do this for everybody.
No, thank you so much.
I wanted to chime in as well. I visited the Center for Special Children with Holmes Morton in central Pennsylvania, and the cultural differences really stood out. I mean, I have more darker skinned Hispanic, and some of the families were a little bit surprised about seeing a physician that looked like me, and there was this, very much I needed a cultural interpreter. They brought food to welcome the doctors, and we were in their center, and it was really a good learning experience. But it was definitely a different community that you needed to connect with, and so definitely they have a history, and they know so much more than an individual who's in training. So we learn so much from our patients.
Well, excellent questions all around. And Dr. Mascia, we really appreciate you presenting. If any of our scholars, E3 scholars, wanted to connect with you in terms of learning more about where you are located, the clinic, or just daily work that you do. You mentioned something about how you don't have enough or you do not have a counseling geneticist, right? So you don't have a counselor so you work that double. It's another job, actually. That's another career that we will be visiting on our next session. We will have a genetic counselor to present. So, but if they wanted to connect with you, what would be the best way in terms of so that you can give them feedback or support, or if they wanted to come and visit even? I don't know.
Yeah, I can put my email in the chat if that would work, or, alternatively, Jekka, you can, distribute my email to the list. Again, I get cold calls from random people all the time wanting to shadow, and I love having students, so I'd be very open to that.
Thank
It
you
is
so
such a beautiful part of the country. I would strongly encourage you guys to get over there. It's the other Lancaster. They have it Lancaster and we have Lancaster spelled the same. So
Yeah, it is beautiful country. On that side, on the eastern side of the US, and it's definitely beautiful. I didn't put her email address, so if you wanted to grab that directly, I definitely will be linking everything that we've talked about to the presentation, to the recorded presentation that I will post this probably in a week or so. And I thank you so much, Dr. Mascia, for taking the time out of your very, very busy schedule. Everything you went through, I kept thinking, oh my goodness, when does she have time to do anything? I mean, you mentioned going to these fundraisers even and running 5Ks. So I just thought that's a lot, but that's pretty awesome. Thank you so much, everyone, for joining us. And we look forward to seeing you on the next session. So session 3 will be happening at the end of July, the last Friday. And we have Dr. Meredith Weaver presenting. She is presenting on genetic counseling. She also has a very interesting path. And so we look forward to seeing you there. And so you will be getting an email again to register next week. So we look forward to seeing you then. Thank you so much, everyone. Have a wonderful rest of your day and weekend. Bye-bye.